Some examples of the non-critical items would be your curing light. A lead apron would be non-critical. Also the position indicating device, the PID on the tube head would be non-critical, as well as even a dental chair would be non-critical. Now, these items must be cleaned with a low or intermediate level disinfectant, an EPA approved disinfectant. Now we're going to move into the guidelines that are established by the CDC for sterilization of patient care items. These CDC establishes the guidelines and they are to be followed. They are encouraged to be followed very closely. There are 7 or 8 guidelines I'd like to discuss with you, and I'm going to briefly read them. You can only use an FDA, Food and Drug Administration, cleared medical device for sterilization and to ensure that the manufacturer's directions are followed at all times. Number 2, clean and heat sterilize critical instruments and items before and after patient use. Number 3, clean and heat sterilize semi-critical items before each use and allow packs to dry in the sterilizer. That is very important because if they are still moist or wet, they can become contaminated again. Now, if the items are heat sensitive, they can reprocess. You can reprocess critical and semi-critical instruments by using FDA cleared sterilants, high-level disinfectants, and follow the manufacturer's directions. And then that was number 4. The item number 5 established by the CDC is to use single-use items. That is an appropriate alternative. Once you use them one time and then they are disposed of. And that is becoming increasingly popular because you can't avoid disease risk and transmission with single-use items. Number 6, do not use liquid chemical sterilants or high-level disinfectants for environmental surfaces that we touch. Examples are like counter space. And we don't want to use that solution for a holding solution as well. And number 7, non-critical patient care items are to be barrier protected or cleaned and disinfected with an EPA approved disinfectant. Now, if the area is visibly soiled with blood, then you would want to use an EPA cleared hospital disinfectant with tuberculocidal claims on it, which would ensure the killing of all microbials. And lastly, you would want to inform the dental health care personnel of all the OSHA guidelines put in place to the exposure that dental personnel have when dealing with chemical agents that are used in the dental workplace.